Hi, my name's Nicole Anderson. I'm in section 302, and our topic for professional issues is the impaired nurse. So today we're going to be discussing the factors on how nearly 10% of the nursing population has alcohol or drug abuse problems. Working as a nurse can be stressful and isolating. Some nurses may turn to drugs and alcohol as a means of coping. The American Nurse Association estimates that approximately 6 to 8% of nurses have substance abuse problems that are serious enough to interfere with their ability to practice. Unfortunately, substance abuse disorders are oftentimes not identified until patient care is compromised. Some of the things our group will discuss today are the signs of an impaired nurse, the implications, such as the impacts on our patients, as well as treatment options. Next up, you'll hear from Christina. She'll tell you about some of the signs you might see in an impaired nurse. I hope you enjoy our presentation.
So some physical signs you'll see in an impaired nurse are glassy eyes or pupil changes, slurred speech and drowsiness, tremors, unsteady gait, sweating, frequent runny nose, frequent nausea, vomiting, and diarrhea, noticeable changes in weight, either weight gain or weight loss, alterations in eating or bathroom habits, and changes in personal grooming. Some behavioral signs you'll see in an impaired nurse are forgetfulness, poor judgment and mistakes, difficulty completing tasks and responsibilities. They'll either arrive late or leave early. Inappropriate behavior such as outbursts of yelling, laughing, or crying. The need for increased break from the work area, lying about behaviors or situations, hyperactivity or hypoactivity, and inappropriate attire for an environment, such as wearing long sleeves in warm weather. Next up, we'll have Jitana, who will be discussing consequences of the impaired nurse.
The impaired nurse will face consequences that will affect them in all aspects of their life. Studies show their colleagues tend to view them as incompetent, feeling as though the education they've received to become a nurse that they should know better. Therefore, they're less empathetic and supportive with their situation. Not only will their actions tarnish their reputation, but can also negatively impact the reputation of their employer. The impaired nurse may lack in their documentation of patient care, as well as the patient care may be diminished. This can also cause potential legal and financial issues for the nurse and the employer via lawsuits filed by patient or patients' families affected by the nurse's impairment. Depending on the situation, the nurse may also temporarily or permanently lose their license to practice. Even after successful completion of a treatment program and having their license reinstated, they may still find it difficult to continue their career as a nurse in the future. And next, we will have Nicole D. speaking to you about the impact on the patients.
Nurses are inherently linked to the proper care and safety of patients. Patient safety is a major concern when it comes to the impaired nurse. Impairment may lead to unsafe or inaccurate care of the patient, which can then lead to a cascade of other problems. Nurses are expected to use clinical decision-making and critical thinking skills. Data collected during the assessment is an integral part in developing a plan of care. The ability to do the assessment successfully, interpret data collected, and develop a plan of care may be impacted by impairment. Another concern is medication errors. Whether it is the wrong dosage, wrong infusion rate, or wrong medication administered, impacts on the patient may be dire. One patient's medication may accidentally be given to another. In this case, you are now involving medication errors for two patients. The nurse may withhold pain medication from the patient to divert it to themselves. This can lead to delayed recovery of the patient and poor outcomes. Home medications brought in on admission may go missing because the nurse takes it for themselves. Insurance may not cover the cost to refill that medication again. This can cause a financial strain on the patient, which may force the patient to do without the medication. Patient dissatisfaction due to the impaired nurse may create frustration within the patient. This can create a situation where the patient is less likely to seek medical attention in the future, leading to a negative patient outcome. And now Bethany will discuss quality and safety recommendations.
The safety and quality recommendations are aimed to help the impaired nurse feel safe about coming forward and asking for help or admitting they need help. This is often the most difficult part for many nurses, but of course patient safety must come first. The goal are for all nurses to be well educated on how to spot an impaired coworker. Several states require ongoing education to help recognize this amongst our peers. It is important that we as nurses always remain vigilant. It is our duty to make sure the quality of care provided by ourselves and coworkers meet the standards expected of us to keep our patients safe. It is recommended that if you suspect an impaired nurse, approach them in private to address your concerns and remind them that there are programs out there to assist them. Then follow the chain of command and talk with the unit manager and provide objective information to support your claims so that the situation can be addressed as swiftly as possible to maintain a safe work environment. Next, Sunny will discuss the ANA scope of practice laws.
The American Nurses Association has a set of ethical standards of nursing, described as the Nursing Code of Ethics. In particular, there is a provision 3.6 labeled as Patient Protection in Impaired Practice. It includes the importance of reporting and assisting impaired nurses. Provision 3.6 reads, nurses must be vigilant to protect the patient, the public, and the profession from potential harm when a colleague's practice in any setting appears to be impaired. The goal of the ANA is to recognize impaired nurses and assist in recovery. It is important for the impaired nurse to recognize when assistance is needed for themselves also. Steps set by the ANA include consult supervisory personnel, supportively approach the impaired nurse with resources, remediation, and recovery. Up next, we'll have Anna discuss the treatment of the impaired nurse.
The impaired nurse has many treatment options available to them. There are inpatient and outpatient facilities, detoxifications, behavioral therapy, and education on addiction. Medications such as diazepam and methadone can be used to help with the symptoms of withdrawal. Behavioral therapy offers coping strategies, teaches ways to avoid drugs, and prevent late relapse. Community reinforcement programs, including Alcoholics Anonymous or Narcotics Anonymous, which create a non-judgmental zone and allows the individual to be around others going through the same treatment process. Support is important from colleagues, family, and friends to help keep the impaired nurse motivated to stay in treatment. Treatment is individualized and sometimes takes many different interventions to be successful. Relapse happens to many during their treatment process. Some may see this as a treatment failure, but this is really a time where the impaired nurse's treatment plan should be reevaluated to figure out what has been successful and what needs to be changed. Many nurses delay help because they are ashamed and are afraid of the negative judgment that other colleagues may give. Next, Sarah will talk about the lack of knowledge people may have about the impaired nurse.
The root of impaired nurses may start before we even realize it. Studies have been traced back to lack of knowledge. A survey done on various different nursing programs asked students how many hours of lecture time were they taught about substance abuse, the effects it can cause, and as well as interventions to decrease the incidence. Less than 5 hours on average was concluded that they spent teaching about the risk of substance use disorders. A conclusion was made to help decrease the risk of substance use disorders. We can maybe increase the time spent on the topic to increase knowledge across the board. It is important for everyone, including healthcare workers, to understand substance use disorders and recognize when they are falling into it. A very important screening question that may be asked is, how do you cope with stress? This is a good way to indicate if a person is able to deal with stress in a healthy way. Overall, increasing our knowledge on substance use disorders can be helpful to decrease the risk of developing it. This concludes our presentation on the impaired nurses, and we hope you enjoyed it. Thanks for listening.